Ovarian cancer is the fifth most cause of cancer death in women in the United States. And this disease causes more deaths than any other cancer of the female reproductive system. Today, I'm here to inform you about ovarian cancer. I chose this topic because I started to be more informed about my health, so I want to share everything that I've learned to other women so they are more informed about their health as well. I'm going to explain what ovarian cancer is, the symptoms, treatment, and the risk factors. Why do you care about this? Because, like I said at the beginning, ovarian cancer causes more deaths than any other cancer in the female reproductive system. You need to know about this cancer so you can be aware if you have a chance of getting it. And fellas, you might also be thinking, why do I care about this if it can affect me? But it can. You probably have someone in your life that's a female that you can share this information to so they are aware of this cancer as well. It's important that we all are informed about this cancer so we know how to recognize if it's there and to know that there is hope in treating it. First, I want to explain what ovarian cancer is. Ovarian cancer is a type of cancer that starts in the ovaries in the female reproductive system. The ovaries are the producer of eggs and hormones. This cancer is very difficult to treat, and it's difficult to treat because it usually gets unnoticed until the very late stages. There's also three types of ovarian cancer. There's epithelial tumors, and these are tumors that are in the outer lining of the ovary, and these are the most common. They account for 90%. We also have stromal tumors, and these are tumors that are in the tissue of the hormone-producing cells. These are usually diagnosed early, and they only account for 7% of tumors. We also have germ cell tumors. These are in the egg-producing cells, and these are very rare. They only account for 3%. There's also 4 stages of ovarian cancer. Stage 1 is when it's only located in the ovaries and it has not spread anywhere else. Stage 2 is located in 1 or 2 ovaries and has spread to the pelvic region. Stage 3, it's in 1 or both ovaries and has spread to beyond the pelvis up here. We also have stage 4, and that's spread everywhere, a lot of places, such as your liver, your lungs, and your spleen. And of course, this cancer does come with symptoms, and these symptoms can be confused with other causes, so this is what makes it really hard to diagnose if you do have ovarian cancer, such as abdominal bloating or swelling, weight loss or weight gain, change in bowel movement, and frequent need to urinate. So you can see that these symptoms go along with other diseases, so it's very hard to diagnose. And although there is no prevention for this cancer, there are treatment options. We have surgery. The first option is removal of 1 ovary and its fallopian tube, and this makes it possible for you to still have kids. The second option is the removal of both of your ovaries and its fallopian tubes. And this makes it possible to have kids if you freeze your eggs because you still have your uterus intact. And then we have the removal of both ovaries, fallopian tubes, and the uterus. And this is where you lose the ability to have kids. We also have the option of surgery after chemotherapy. This happens when the cancer is too spread that you can't just get it all from surgery. You have to shrink the tumors down to actually remove them. There's also, and then chemotherapy is a drug treatment that kills fast-growing cells. There's also targeted therapy. This is where they have medications that target the weakness of your cancer cells, and this is usually reserved if your cancer comes back. And furthermore, there are also many risk factors that provoke this cancer. First, we have age. 2/3 of women diagnosed with ovarian cancer are 55 or older, so you're more likely, the more older you are, the more likely you are to get it. It's also inherited. This is only a small percentage, and it's usually if you have 1, 2, or more people in your family that have ovarian cancer, you're very likely to get this disease as well. Also, if you take hormone replacement therapy, you're at higher risks as well. But this is usually used by women who are older, so this can relate back to age. When you hit menopause, you don't produce as much hormones, so you take hormones, and this can increase your risk for ovarian cancer. There's also age when menstruation started and ended. If you start your period at a really young age, you're high risk, and if you end your period at a very late age, you are also a high risk. In conclusion, ovarian cancer is a very life-threatening disease. Ovarian cancer is a cancer that happens in the ovaries of the female reproductive system. This cancer is very hard to diagnose and sometimes difficult to treat because of the many types and stages of this cancer. Even though it's hard to diagnose, it comes with symptoms to signal its appearance on the female body. There is no prevention for this cancer, but there are treatment options for it. And finally, there are many risk factors that every woman should know so that they are aware and pay attention if you have ovarian cancer. Today, I hope I brought some new information to your life about ovarian cancer and help you be more aware about your health. It's important to know about this because no one else is in your body. You're the only one that can truly take care of yourself and know that something is changing. Thank you.